Hello. Once again, I'd like to welcome you all to the webinar. My name is Brenda Mahishi, and I am a data project manager for the Child and Family Data Archive, also known as CFData. Our data release webinar is called Accessing and Using the Understanding Children's Transitions from Head Start to Kindergarten, or HS2K data. I'm joined today by my colleague from NORC, Stacy Ehrlich-Lowy, who is the project director for the HS2K study. Before I turn the presentation over to her, I'll briefly introduce you to CFData and let you know more about the structure of this webinar. This webinar is hosted by CFData, which is where you go to access the HS2K data. CFData is supported by a contract from the Office of Planning, Research, and Evaluation, or OPRE, and housed at ICPSR within the University of Michigan. It is the place to discover, access, and analyze data on young children, their families and communities, and the programs that serve them. Users are able to access over 350 data sets with the ability to analyze select data sets online. You can also search and compare variables and peruse data-related publications. And of course, user support is available to assist users in finding and obtaining data. I will be going into a little more detail about the archive later on in the webinar. For today's webinar, Stacy will provide you with an overview of the HS2K project, as well as information on the data file structure and user resources. Following those sections, I will give an overview of CFData and the resources that we have to support researchers. Importantly, I will focus on how users can request access to the HS2K data through the CFData website. And then finally, we'll close with a brief question and answer session. I am now happy to pass the presentation over to Stacy so she can share more information on the HS2K study.
Thank you, Brenda. All right, I'll start just by saying thank you to everyone for joining us today to learn more about the HS2K project and the data that will be available through the archive. As Brenda mentioned, my name is Stacy Ehrlich-Lowy, and I am the project director for HS2K. I'd like to start with a quick overview of the project to help contextualize the case study we did and the data that will be available through CFData. I'd also like to quickly acknowledge my co-PI, Kyle DeMeo-Cook, and co-task lead for the case studies, Molly Gordon, who are also on this webinar, our other co-task lead for the case studies, and the lead for data archiving, Carol Hafford, was not able to join today, but we want to thank her for her contributions as well. Many of us know that children's early development can set the stage for ongoing learning. To promote this ongoing learning and build upon early successes, both ECE practitioners and K-12 local education agencies, or LEAs, should consider each other's roles and coordinate their efforts in supporting children and families throughout the kindergarten transition. These coordination efforts include alignment of transition goals, approaches, and practices, which can set the stage for successful longer-term outcomes. Towards that goal, the purpose of this project was to better understand how to improve children's transitions from Head Start programs into elementary schools. The case studies we'll discuss today were intended to catalog and explore transition strategies and approaches holistically and in local contexts. The next 3 slides will help us understand the framing for our case study. We began this project by building out this depiction of the landscape or the ecosystem of kindergarten transitions. Overall, this landscape highlights just how complex this multi-system, multi-level process is. And there are 3 primary points embedded in this graphic that are relevant to our case studies. First, transitions involve 2 sides. There's the side that sends children, or Head Start, and the side that receives children, or kindergarten. Our case studies include both of these sides. Second, each side is a system with its own goals and perspectives, practices, and supports for teachers and other professionals, as well as policies that influence the work across different levels: classroom, school, district, state. The layers of the visual depict these organizational levels within each system, which influence one another and influence transitions to kindergarten. Our case studies attend to each of these systems and the organizational levels within each system by including the voices of staff from all levels and of families. Lastly, at the bottom of the visual are the children who make the transition from Head Start to kindergarten. Arrows between the children in Head Start and kindergarten classrooms represent the complex feeder patterns that exist, with children who attend the same Head Start classroom transitioning to multiple kindergarten classrooms, elementary schools, and/or local education agencies. In our case studies, we are not able to capture all of this complexity, but we do focus on one partnership between a Head Start program and an LEA in one of their elementary schools. The broader context is important to keep in mind, however. Key to our landscape are what we call the 4 Ps: policies, perspectives, professional supports, and practices. Taken together, these 4 Ps are the core mechanisms that the HS2K project theorizes shape a child's transition experience. Although the 4 Ps were uniquely defined for this project, similar constructs do appear in the literature on effective school leadership and implementation science. We hypothesize, based on existing evidence, that if teachers, administrators, and education leaders from Head Start and elementary schools commit to a shared or aligned set of perspectives, policies, professional supports, and practices, then children and families will have a more positive kindergarten transition experience. This was a large focus of our case studies, understanding these 4 Ps and how they looked within the context of Head Start LEA partnerships. Based on the knowledge of existing, based on our knowledge, review of the knowledge base and existing landscape, our 4 Ps framework, our team constructed the following theory of change. Together, our landscape, the 4 Ps, and our theory of change provide the foundation on which the rest of our project rests, including our case studies. I will admit that this is a complex graphic with lots of different components, but you will see both the 2 systems on either side of the transition represented here, as well as the 4 Ps, both within each system and shared across the systems. We know there will likely be lots of questions about how all of these pieces fit together, so we would like to invite you to scan the QR code on the screen using your smartphone's camera app and watch our explainer video on YouTube. My colleague will also share a link in the chat that takes you directly to the YouTube video. On the next slide, for further context on this study, please see our OPRE project page. 2 previous publications have direct relevance to these case studies. One is a review of the knowledge base in our theory of change, published in 2021. The other is a brief that explores the context of some of the memoranda of understanding between Head Start programs and LEAs. Reviews of these types of documents were also included in our case study. And the QR code there will take you to our project page. Let's now turn to understanding the design of the case study, including our research questions and the participants and instruments. The primary goals of this comparative case study, multi-case study, were to understand first the multi-layer perspectives, policies, professional supports, and practices, or the 4 Ps, around kindergarten transitions within Head Start, within elementary schools, and across systems, including the organizational context that influence those transitions. And 2, the direct experiences of families and their children. This slide shows the research questions that guided our case studies, and they focused on the strategies and practices that Head Start programs and elementary schools were implementing to support children as they transition from Head Start to kindergarten. We focused it on understanding what characterized the relationships or partnerships among those Head Start programs, elementary schools, and other community partners that support children in transitioning from Head Start to kindergarten. And we asked about key perceived short and long-term outcomes of transition strategies and practices for children, families, Head Start teachers, and kindergarten teachers. And throughout these, what the key contextual factors and mechanisms were that resulted in those outcomes. The HS2K team conducted a comparative multi-case study, taking an ecological perspective to studying promising transition approaches from Head Start to kindergarten. A comparative case study design involves qualitative framework methods and naturalistic or interpretive inquiries. We began conducting the case studies focused on the processes in context within bounded systems. For this study, we refer to the Head Start and LEA bounded system as a case, and the individual Head Start grantees, delegates, or centers, and the LEAs and elementary schools within these cases as sites. After a thorough nomination and recruitment process, our team recruited 5 partnerships that we call cases, and each of those cases consists of the one Head Start program and one partner LEA. This pre-existing relationship was the most important selection criteria for us, but we also took other factors into account, like geographic location, urbanicity, the different types of feeder patterns represented at sites within these partnerships, and community demographics, such as race, ethnicity, and community languages other than English. Our goal was to select a diverse sample across these characteristics. To foster comparability across the Head Start programs and LEAs, we interviewed people in parallel roles across the systems. On the Head Start side, we interviewed program administrators, managers, and coordinators, center directors, classroom teachers, and center support staff. On the K-12 side, we interviewed district administrators, district staff, elementary principals, classroom teachers, and school support staff. And to round out our understanding of the partnership and the community in which it was situated, we interviewed one community partner and or service provider that our Head Start and LEA respondents identified as important players in the kindergarten transition landscape. We began initial data collection over a year ago in April 2022 and continued on throughout the summer. During this timeframe, we conducted interviews at each of the levels across the systems I underscored, collected policy documents such as Memoranda of Understanding and transition plans, fielded a staff collaboration survey intended to probe on the types of connections that exist within and across systems, and finally, conducted focus groups among family members and caregivers of Head Start children about to transition to kindergarten. We then followed up with a subset of those caregivers in December 2022 for a follow-up interview to see how that transition went for them and their child. As mentioned, we conducted interviews with Head Start and LEA staff at multiple levels of the systems, the LEA, school, program, center, classroom, and focus groups with Head Start parents at our 5 cases. We then, as I mentioned, conducted follow-up interviews with a subset of those focus group parents following their child's transition to kindergarten. All interviews and focus groups took place via Zoom. Given the time frame, this was sort of as folks were recovering from COVID. Participants were free to conduct the Zoom call in any location of their choosing, and they provided consent to have the call recorded. The interviews, the team conducted 59 semi-structured staff interviews with Head Start and LEA administrators and staff. The interviews lasted between 45 and 90 minutes, depending on the role. They were conducted in English and a couple of them in Spanish, and the interviews were professionally transcribed. The focus groups were used to obtain in-depth understanding of families' experiences with the transition. The HS2K team conducted 6 virtual focus groups via Zoom with Head Start families that lasted approximately 90 minutes. However, for 2 of the focus groups, only 1 parent joined the group, which made the session more of a one-on-one interview. Focus groups were conducted in English or Spanish to match parents' native language and preferences. Those were also professionally transcribed. For the follow-up post-transition family interviews, we conducted interviews with parents who indicated interest in that follow-up interview in between December 2022 and January 2013. 5 individual interviews for 45 minutes each were conducted via Zoom. These interviews sought to understand how parents and children experience the transition from Head Start to kindergarten once those children have made the transition, and their perceptions of the helpfulness of the transition supports and activities that were described by the Head Start and LEA staff in our prior interviews. These interviews were all conducted in English and were also professionally transcribed. All participants were offered a gift card immediately following their interview in appreciation for their contributions. For each site, we talked with administrators, site level leaders, staff and teachers, and community partners. This table shows the total number of participants by each one of those roles. And the range, you can see the range on the bottom per case. Thanks. The research team leads developed a code book based on the research questions, the HS2K theory of change, and constructs. The initial codebook contained a priori codes drawn from the protocols and organized by the research questions and related constructs. Additional inductive codes were added during the analysis process as team members discussed understandings of the data. All case study team members were trained in how to use the codebook. Individual case study teams coded interviews in using the Deduce qualitative software program. And the coding team met weekly to hold targeted consensus building discussions to answer specific questions and discuss convergent or conflicting coding and themes, as well as to review inductive codes that emerged. While the codebook itself will not be archived, tables that include the codes and definitions will be included as an appendix to the full comparative multi-case study report that will be published this fall. This is an example of what that will look like. Note, however, that the raw data are what are going to be archived, the transcripts, which we'll talk through, and not the coded data. Our findings will be released via this full report that I just mentioned in the next month or two. And although we cannot share those findings yet, we did want to ensure that folks know how the data were analyzed and what will be available through CFData. Okay, so we'll shift into those data structure and resources. This table provides a more detailed information about our sample. It's shown by each of the cases in our study. We collected information from a similar set of respondents on both the Head Start and LEA sides to foster comparability. Because participants and case study sites were purposefully selected, they are not representative of the population of Head Start agencies, Head Start programs, LEAs, elementary schools, or community service partner staff. Participating families are also not representative of the population that programs or schools serve. Instead, we aim to obtain variation in families' experiences to understand engagement with the range of transition activities and supports within a given site. While not strictly structured, the research team used a more structured interview approach for both the interviews and focus groups to reduce variability, since there were multiple researchers conducting the interviews and focus groups in multiple sites. Although protocols were structured, all of the interview questions were open-ended, and the participants were encouraged to elaborate and give examples. In addition, researchers were encouraged to ask probing questions when necessary to elicit more information about the outlined topics or themes as time allowed. Informed consent was included in each protocol. All respondents were informed of all the planned uses of the data, that their participation was voluntary, and that their information would be kept private to the extent permitted by law and in accordance with current federal information security standards and other applicable regulations. Here we have a list of the key topics addressed through the interviews and focus groups. Transition activities and practices, relationships to support transitions, contextual factors that may support transitions, and perceptions of outcomes of transition efforts. Each of the next several slides presents in more detail the nuances of the broader categories I just mentioned on the previous slide. So here are the topics under the construct of kindergarten transition strategies and practices, including, for example, how participants defined what a successful transition was, the types of supports and practices implemented that focus on kindergarten transitions, and challenges and benefits of those approaches. These are the topics under the construct of relationships to support kindergarten transitions, including, for example, how staff in Head Start programs and elementary schools coordinated their efforts to support kindergarten transitions, key characteristics of their relationships, and facilitators and barriers to those collaborations. This slide shows the topics under the last two constructs. First, contextual factors that might influence the transition practices and experiences, such as backgrounds and experiences of those who participated in our study, and family perceptions about the learning environments in both Head Start and kindergarten. Under perceived outcomes, participants were asked what they thought key outcomes would be of a successful transition. The process of protecting the identity of the individual participants in our case study included multiple steps as outlined here. As part of these processes, we identified and removed or replaced direct and indirect identifiers. We replaced direct identifiers, including actual names of persons, positions, programs, schools, or locales with a generic term. We replaced dates with the generalized timeframes, and we replaced exact numbers such as years of employment, number of school districts in an area, or number of enrolled children with a range. If there was unique and/or publicized items, we removed the entire text and noted that it had been removed. Examples of indirect identifiers could include information about Head Start and elementary school seasonal calendars, percent dual language learners served, LEA or district school policies, or some type of community context, for example, disasters that pertain to a particular case or site, and we removed those as well. The next couple of slides list out all of the files that will be available through CFData. They are organized by case, then the system, and then the participant type or role. And you'll see each of these slides, which will be archived, list all of the files that will be available. In some of these cases, we have transcripts from individual family members, family interviews conducted when their child was in kindergarten, as you'll see on this slide here. And that's case 4, and then we have one for case 5. So we'll just wrap up with a couple of considerations when using these data. As I mentioned, these cases were selected very purposefully, and we were trying to identify innovative strategies and approaches. And these sites offered their time. So there's self-selection, which does prohibit the generalizability of these findings. These are also very context-specific findings, so they're not generalizable from that perspective as well. They're illustrative, and they are in-depth explorations of relationships and practices within those specific contexts. And then finally, just a note about the impact of COVID-19. This was, again, in most of the data collected in 2022, and there were some mentions about the changes in the partnerships or relationships, things that had been put on pause because of COVID-19, changes in the strategies and practices, and changes to our approach to doing the data collection, which originally had been planned to be done in person. That might have limited some of the participation, particularly amongst parents. At this point, we have completed analyses and the findings will be published soon. The data and data documentation will be available via CFData for others to use. That's TBD. We are almost finished getting those prepared, but we're excited to see how others will analyze the rich qualitative data that were collected as part of this study. And finally, just a note about the publications that will be coming out in the next month or two. We have the full comparative case study report that I mentioned. We also have a practitioner-friendly brief that will be highlighting key findings from both the case study analyses as well as other HS2K project activities. And finally, we will have a synthesis website. So we will have a website that pulls together and summarizes all of the activities completed under the HS2K project and how they all speak to each other.
Thank you, Stacy. Next, I am going to give a brief overview of the Child and Family Data Archive. So launched in 2019, CFData preserves and disseminates data on topics related to young children, their families and communities, and the programs that serve them. So the HS2K data is one of the hundreds of data sets that are archived at CFData, along with accompanying documentation for secondary data analysis. And all of these data are available to researchers to analyze free of charge. CFData has a range of data, including on federal and state funded programs such as Head Start, Child Care and Development Fund Block Grant, and the Maternal, Infant, and Early Childhood Home Visiting Program. We also have administrative data, community-based surveys focused on parent and child development, and observational studies in classrooms and homes. The CFData website is available at childandfamilydataarchive.org. Through the website, users can explore data, learn more about childcare and early education research, and discover the training opportunities presented by us. So the first tab on the website, circled here in red, is called Getting Started, and it provides a great overview for new users to the site of some of the highlights of the website, and it has quick links to various resources that might be helpful to you. Under the Data tab, users can search and browse the entire CFData catalog, including by release date to find recently released or updated data, or by subject terms if you're not quite sure where to start or what you're looking for. There's also a helpful how to access data page that can help you learn more about the access methods and application process. Other data-related tabs include the variables and publications tabs. So these allow users to search for variables across all the studies that are housed at CFData. And you can also look for publications of interest, which show which publications have cited a particular study, and then you can link back to that study. Under the About Us tab, users can learn more about CFData, about our project team, and about announcements, data releases, and upcoming trainings here under the News link. We also have a collection of video resources right here under the Resources tab, and that's where you'll find the videos of data release webinars and their accompanying slides, as well as other types of data trainings that are offered by data producers. And then you can filter by a particular data set or series right here where the arrow is. And a video recording of today's webinar will also be added to this page when it's available. So this was just a brief overview of CFData. But to learn more about the archive, we encourage you to visit us at our website, and on the About Us page, you can watch a fun, short 2-minute video that introduces you to the collection and the resources that we provide to users like you. So now let's turn to how you can access the HS2K data. So to find the study, enter the study title or the acronym HS2K in the search box on the home page. And then you can hit enter or click on the magnifying glass, and that will take you to the search results page. So here we have an example using FACES 2019, where you can see that the first study that appears is the FACES 2019 study. And when you click on the name, that will take you to the study homepage. So this is a screenshot of an example study homepage. Once the HS2K data are released later this fall, there will be a similar study page available for HS2K. So the homepage is where you will find important information, such as a summary about the study and information on the study's methodology. And you'll also be able to view publications based on the use of the HS2K data in particular. So users can also preview and download the public documentation that is available for this study under the Data and Documentation tab. But because this is a restricted data set, a restricted data application is required to gain access due to the sensitive nature of the data. So once you've explored the documentation and decided that you'd like to use this data, you can begin your application by clicking on the Access Restricted Data button highlighted here. And that will take you to the application page for the ICPSR Virtual Data Enclave System, or VDE. So the VDE allows users to access the data from a secure remote desktop, and then you can use that to collaborate with other researchers on your team within your virtual workspace. And it also has useful qualitative data software programs available, such as MaxQDA. The application itself requires several pieces of information, including a description of the intended research project and why you need the data, a list of research staff, an IRB determination letter, and a signed restricted data use agreement. For the VDE, users are also required to watch a brief security training video and then complete a quiz prior to approval. Archive staff are available to assist you with your application and to answer any questions that you might have along the way. So just email us at cfdata-help@umich.edu. And if you can include your application request number that we can refer to, that would be great. And now we are happy to take a few questions. So feel free to type your question into the question box, or you can raise your hand if you'd like to ask it out loud and we can unmute your mic. So I actually do see some questions have been coming in. So let me just go ahead and start. I see that somebody had asked us, are any of the Head Start programs tribal Head Start?
So in our report, when it gets published, there will be information about the Head Start agency type that is made available there. But beyond that, because we need to protect the identity of these cases as much as possible, any further information is not available.
Right. You have a question. Could you give us some more information about what kind of questions could possibly be answered with these data?
Yeah, I suppose the world is your oyster. There are questions, for instance, that folks might be interested in around how things might have changed from before COVID to after COVID. That wasn't the focus of this study, but there were some questions in our protocols that focused on that. Folks might be interested in looking at information by particular roles or particular systems and take a look at what that looks like systematically. In our study, we kind of touched on everything a little bit, but you could probably go deeper into those different topic areas and constructs that we have identified for you.
People also wanted to know, what is a code book for qualitative data?
Molly, do you want to take that?
Sure. A codebook is kind of a framework that you use to, I don't know a better term, but chunk the data. So putting data in buckets based on theme or construct. And so it's reading through, like Stacy mentioned, I pre-identified some codes based on the conceptual framework and based on the protocol questions and literature review. And she listed all of those different kind of constructs that we put into the code book. And then we read through transcripts and put pieces of information under each construct or bucket. So let's say we asked a question about practices and somebody answered about the types of practices they were engaging in around supporting transitions. We then highlighted that piece of information and put it under, a code called practices, so that somebody could then identify all of the different types of ways that people spoke about or perceived the types of practices that they were focused on. And so that's how we conducted the analysis for this. But as Stacy mentioned, the code book itself is available, but the coded data is not. And so we just have raw transcripts.
Yeah, and the reason for that, the reason we're providing the code book, even though we're not archiving the data as coded, is so that folks have a sense of how we analyze the data, what we were looking for when we were analyzing the data. And what that means is that if other people have access or request access to the transcripts, you could create codes that focus on other topics that we might not have specifically looked at or looked for, and do your own analyses using those.
In addition to the qualitative data collected from this project, are any quantitative data, such as children's kindergarten readiness assessment, accompanying these cases, available?
There are not. The only quantitative data collection that occurred as part of this study I mentioned at one point that we collected information on staff collaboration. So we had a survey that was administered to all of the staff who we interviewed in each of the cases, asking them who they collaborated with, how frequently they collaborated with them around supporting kindergarten transitions. And the data are not archived because the ends are very small. That's one reason. Another is that it could become very identifiable quickly. And the third is that we present pretty good analyses and nuanced analyses about those data in our report. So there's definitely information that comes out of those surveys, but there's not all that much more that could be done with those data. And so we opted not to archive them. And we did not collect any other type of quantitative data.
Will all the data collection protocols be publicly available?
Yes, they will.
Okay. Great. Those were all the questions that we had come in. Please feel free to type anything in that you can think of. Otherwise, we are happy to answer questions via email. So if you would like to, let me get to the next slide. You can contact us again at cfdata-help@umich.edu. And I also want to quickly remind you to visit the CFData website to request access to these data when they are available. You can also sign up for our listserv and to receive notifications on data release announcements, data webinars and workshops, and our quarterly newsletter. We will be sending out a notification to everyone who registered for this webinar when the recording is uploaded and the study data are released. I see another question just came in. So will the reliability coefficients be provided for the coded data?
I can start this, and Molly, you can add what, or Kyle. No, we don't have any calculated reliability coefficients for coding. As I mentioned, there was a continual process, and there was some checking across different coders, but there was a joint process for discussing scenarios where there might be differences in or lack of clarity around how to code information, but there is no actual coefficient available. Anything to add, Molly or Kyle?
I would just add that we didn't calculate those, but like Stacy said, we had a pretty rigorous system and met multiple times. And we didn't think, it would be that valuable, given that we have the data that's being archived is not the coded data. And so therefore, different set of coders might have a different reliability structure, depending on if you had multiple coders coding the same data.
Okay, great. I want to don't see any more questions in the queue at the moment. So again, just feel free to email us if anything comes up. But I'd just like to thank everyone for joining us today. And I want to thank Stacy and Kyle and Molly from NORC for sharing all of this information and answering our questions. Yes, I see thank yous coming in. Yes, thank you, everyone.